So our next company, I have to admit, had some trepidation when we first met, the Weiner brothers. My siblings and I can't even agree on a bouquet for my mom for Mother's Day, let alone try to start a company together. But I'm here to tell you that after witnessing the dynamics over the last 16 weeks, my fears were completely unfounded. Not only do they operate like a well-oiled machine, but they've chosen to tackle a huge problem with a very innovative solution. And even better, they have real-world experience in exactly what they're trying to fix. So this is a team and a company you want to keep your eyes on. Avhana Health.
Thank you, Jason. I'm really excited here to tell you that I left my job here at Hopkins to pursue something that I felt like I could do really well and that the whole world needed to see. So a lot of you may be shocked to learn that we actually don't receive the care that we're supposed to receive. A random study has shown, on average, we only receive the correct care little more than half the time for some of the most common diseases. This actually means there are millions of people out there in the world not receiving the care that the world's experts recommend. I'm not trying to put physicians on the bus here, but who's to blame? We're in an era of information overload. I'm sure every person in this room can relate to this. Just think of your home office, and how many journals and papers you have sitting on top of it. There's no way for you to memorize all this information. There's just way too much out there. A prominent study has shown that it takes on average 17 years for evidence-based practices to reach clinical practice to reach evidence. This means that there's a lot of research out there. So let me put this in appropriate. Let's say if you have a kid tomorrow and new guidelines come out. I will actually bet that your kid gets in college first before the guidelines come into clinical practice. That's how crazy it is. This was actually once the promise of electronic medical records to fix this, but they are just the first step, not the final step. There's still a huge gulf between the guideline agencies and these medical records. So that means that every time a new guideline comes out, someone has to individually build this into the medical record. This is actually something I experienced firsthand working here at Johns Hopkins. I actually worked on the EPIC project, building these certain rules, these guidelines here. And I thought to myself, why am I doing this? There's thousands of people out here doing this. And we're at the world's best institution. At the same time, how could a local community hospital that doesn't have the same resources that they have here do this? So this is actually why I founded Avhana Health. We want to bridge the gap between these guidelines and these electronic medical records. We pool this information and deliver it to the physician when and where they need it. I wish it was just about what's best for patients, but it's never been more important to have a product like this. There's a lot of financial incentive involved. More and more, the physician's reimbursement is going to be tied to following these best practices and doing the correct thing. More and more, a physician's reimbursement is going to look something like an ACO or patient-centered medical home. That's the future, and it's here to stay. On average, a physician's practice is actually leaving $100,000 on the table by not subscribing to Avhana. That's real money that they could be making by not subscribing to our product. Now let me actually show you how it works. A physician logs in and we produce an adaptive checklist at the point of care for personalized to the patient right in front of them. This is a guide that tells them what to do with the encounter. They don't have to spend the few moments they have with the patient looking through the medical record, looking through the guidelines, and wasting their precious time realizing what they do. We provide it right there and how to maximize their reimbursement. We tell them exactly what tests they need to do, when it's due, and how they will be reported on, which is a huge plus. In addition, if they have any questions about it, they can actually go to the guidelines and research it. Even though we're only 3 months old, we have actually built some great relationships with some of the best ambulatory electronic medical records in the world. And I would actually like to thank Caitlin from Samples from Greenwood, who actually came out here today to watch the presentation. We are very happy to announce that we'll be available in the marketplace by the end of the summer. Well, President Daniels mentioned earlier that a lot of times when you do a startup, you have to leave your family. I'm very fortunate that I actually just had to look down the hallway to find my co-founder. My brother was the best case scenario for me. He studied entrepreneurship at Wharton. In addition, he worked with the best practice and protocols, designing the very room we are in today. We also have Chase and Dennis, two experienced developers who actually have previously worked with startups. To keep on going, to accelerate the momentum we have gathered in the last few months, we hope to get our product into 1,000 physicians' offices over the next year. For these reasons, we are raising $500,000, which will allow us to deliver this product. At Avhana Health, we believe that everyone deserves the best practice, and we need your help to do it. Thank you.